welcome to Talking Live. I'm Dr. Robi Ludwig, right here in Starshot Studio. Today we're talking about a serious topic that has reached epic proportions: opioid crisis. The opioid addiction rate has increased and has caused so many deaths, and we are so fortunate to have a leader at the forefront of treatment and recovery, Dr. Russell Surasky, who is a licensed board-certified neurologist and also addiction specialist, which is very rare. We're so thrilled to have you.
Thank you. I'm so happy to be here.
Yeah, I mean, you have such an interesting specialty. And from my research, the research I found, it said that over 130 people a day can die from this crisis.
Are dying, absolutely.
Yeah,
yes.
That's a lot of people.
Sure. And I just want to start by saying thank you so much for having me on the show today, because we're going to be talking about such life-changing, life-saving information for the countless people out there who are suffering with opiate addiction and who are struggling and they can't find the help that they need. And it's such a deadly crisis. And we have new hope with new treatments that have come out. And now nobody is beyond reach to get help. We can save pretty much anyone so long as they can find the help.
And there's a lot of shame associated with this kind of addiction. So there are a lot of people out there who were prescribed opioids and then found themselves addicted and then live in silence because of just fear what it means, or they didn't consider themselves in sync with what an addict looks like.
Absolutely, that is true. Now, what we know, what we're learning, and we don't know all of the DNA sequencing and genetics, but we know that about 20% of the population, when they take opiates, it doesn't simply bind to the brain and reduce pain. In fact, what's going on is it's setting off a very dangerous cascade of neurological changes inside the brain that then can send that patient spiraling into an opiate addiction that ultimately can destroy their life. And that's a large percentage of the population, and we find ourselves in this terrible epidemic now.
How did you find yourself in this space? So you speak to law enforcement, you speak to physicians. You are the only person currently in the country that is board certified in neurology and addiction, correct?
That's correct, yes. So after I finished my neurology residency at North Shore LIJ, I went into practice, and what I was seeing from the very beginning was that everyone coming in the door, or 90% plus, were either physically dependent or addicted on opiates of some kind. And they were being shuffled from doctor to doctor without getting any real help, just looking for refills of the medications. And at the same time, I had people close to me, personal friends and family, who were also, I was seeing, was getting caught up in this cycle. And there really wasn't good help out there. What I was seeing was people were going from detox to rehab to detox, and many of them ultimately winding up, God forbid, overdosing or in jail. And so I said this was extremely alarming. I went back to, after 10 years of training to become a neurologist, I went back to training to become an addiction specialist. It turns out brain addiction is actually a brain disorder, not a moral failing, okay? And ever since I came back from training and I've seen what these revolutionary new treatments can do, the life that they can restore in people, I never look back. There's only one thing that I do, not many things, one thing, and that is to help patients whose brains are hijacked by these drugs, help set them free and get their life back.
So what is the sign of the signs of somebody who actually is addicted to opioids? Let's just take our audience back, just in case they might be struggling themselves and not identify themselves as having an addiction, or they know a family member that is struggling.
Sure. So I think it's important to distinguish between physical dependency, which comes from anyone taking an opiate prescription for a prolonged period of time, versus actually developing an addiction, okay? These are actually different conditions, and they're often confused, even by doctors. Physical dependency is going to happen to anyone who takes opiates for a prolonged period of time. It simply means that you're going to have withdrawal symptoms when you stop, okay? That's just from the changes that they make to your brain. But addiction is a specific behavioral pattern in which somebody specifically, compulsively seeks out and thinks about the drug, compulsively uses the drug despite recurrent harm in their life, and it's a condition where there's recurring relapses in their life. So, anyone can have withdrawal when they try to taper off of an opiate prescription from their doctor, but only a certain percentage of the population are going to then go out and compulsively seek out a drug and develop drug addiction. And there's strong genetics behind who's susceptible. We just haven't figured it out where we can tell in the first place.
Now, how did we get to this place? From my research, the pharmaceutical companies initially told doctors that opioids were okay to use and that they would not create an addiction. So doctors at that point would give it to patients, and yet the reality was something very different. How did we get to this place, and how bad is the crisis at this point?
So it's the worst epidemic in American history by far. Right now we have about 130 overdose deaths per day, okay? And, it's multifactorial as to how we wound up in this situation. But I can tell you that essentially what happened was some of the bigger pharmaceutical companies who manufactured opiates falsely marketed these drugs to doctors as a panacea for all of their patients' pain. And that the big lie that was told was, if your patient is just taking it for pain, then they're not going to get addicted. Okay, and that was, of course, not true, because we know a large percentage of the population who takes these drugs is going to get addicted. Okay, so instead of these drugs being used for severe, unrelenting chronic pain from severe illnesses, now doctors are giving it out for migraines, back pain, arthritis, everything that ails you. And so now we find ourselves in one of, again, the most horrendous epidemic the United States has ever faced.
What does an opioid do?
Sure.
What kind of impact does it have on the body, and what is it supposed to do?
Okay, great question. So opiates are a family of pain medications that all work in a particular way. Now there's a lot of common household names like Percocet, Vicodin, oxycodone. We've all heard these names. These drugs bind to a specific part of the brain to try to numb it from the pain signals coming from the body. Okay? But again, the problem is that if you're genetically susceptible, what happens is it's not simply the pain relief that ensues, but rather this devastating, addictive, neurological cascade that can destroy somebody's life. And so here we are, facing a horrendous opiate epidemic, and unfortunately, there's not a lot of good help to be found.
Can we tell ahead of time genetically who would be more inclined to be addicted? And now that we know this about the opioids, is it ever okay to prescribe?
Yes, so of course you have to look at the whole picture, and a clinician has to use their judgment as to who is best suited for a short course of opiates, okay? I think that it's very important that the physician is taking into account the whole patient, everything that's going on in their life before you prescribe them something that could potentially really hurt them, and that's not what was happening. And so now, unfortunately, we don't have genetic markers yet. They're coming. We don't have them yet. We have some screening tools, questionnaires to try to determine if someone has a susceptibility to addiction, but quite honestly, they don't hold muster, and they're not very helpful at this point.
You mentioned about the opioid fentanyl, which we have heard a lot in the news. Michael Jackson died of an overdose.
Of course.
I believe Prince
Yes,
died
absolutely.
of an overdose. My understanding of this drug is it was only supposed to be given before you have an operation. Is that true?
Yes, that's nearly 100% correct.
Okay.
Or in cases of terminal cancer pain.
Okay.
Okay. So fentanyl is an opiate just like oxycodone, hydrocodone. By the way, heroin is the same exact mechanism as all the other pills. It's just that heroin's on the street and can't be prescribed. So usually people find their way to heroin by way of first being addicted to opiate pills, but because they're more expensive on the street, they wind up getting heroin. But it's the same mechanism in the brain. Now, you're hearing about fentanyl a lot on the news because fentanyl is 100 times more potent than morphine. And what drug dealers are doing is they are cutting it and mixing it into fake pills on the street and heroin, which is causing the already astronomical overdose statistics to just continue to skyrocket.
For somebody like a Michael Jackson or Prince, did they know what they were taking? Did they know they were taking fentanyl and that it was deadly? I mean, what we heard in the news was that Michael Jackson used it to help him go to sleep.
Okay, so I'm not intimately familiar with all the details of those
Yeah.
cases, but I know that there was also propofol involved with Michael Jackson, which is a different type of drug. But I know that from what I've read and heard, that there were opiates also involved there, and Prince certainly with fentanyl. And I think that there was an understanding. They had private physicians who I think probably wanted to appease them, and they were prescribing fentanyl. And unfortunately, it's a runaway train of addiction and destruction, and really it becomes deadly.
I mean, I think we really need to appreciate our bodies. And there are drugs out there that can kill you. And it is very frightening out there. And you mentioned a point that I just also want to highlight, which I think is so important. There was a prescription, right? An opioid prescription, like Oxycontin, somebody becomes addicted. It's very expensive to get, and that's when people then would be more inclined to get heroin, which is cheaper on the street, and we know how dangerous that is. And then we're in this dangerous loop.
But I'd like to just jump in here about, there's the perception by people who have addiction that if they stick with the pills, if they can afford to pay for the pills, that somehow they're more safe than people who are using heroin. But it's in fact not true, because 80% plus, I see hundreds and hundreds of urines. I also run a rehab. I'm in private practice, so I see hundreds of urine toxicologies a week. And I can tell you that even the pills, over 80% of the supply out there is pressed. They're fake pills. They're not real oxycodone pills, and they have fentanyl in them. So we're seeing young kids trying it for the first time and dying from 1 or 2 pills because they're pressed with fentanyl. So fentanyl is in everything. Even other drugs like cocaine and Xanax, people are overdosing. And it is frightening.
It's very scary, especially for those of us who have kids in college.
Absolutely.
And that kids try anything. And
Absolutely.
They have no awareness that they could be putting themselves in danger. It's very frightening,
to say the least.
Doctors now are very careful about prescribing opioids, and there's a limit. It's very hard to prescribe right now. So if somebody is over prescribing, I think that there's a red flag that goes up. Is that true?
Yes, there are some red flags that go up, and a lot of doctors were essentially, they were dealing drugs with white coats on, and their entire practices were made that way, and a lot of them wound up going away to prison. But there still are doctors who I think are very liberal with these drugs, and ultimately I think the pendulum is starting to swing back the other direction, and it is getting a little more difficult, as it should be. These were not meant to be medications for daily aches and pains, because then you wind up with the situation we have now.
Right. And you're going to tell us a little bit about some of the latest discoveries about addiction and the field of brain science as well, because I think once we found ourselves medically in this place, we wanted to do something about it.
Absolutely.
And say, hey, what are other treatments that are available to manage pain so we don't find ourselves in this place?
Absolutely.
What have we discovered?
Okay, so I think first, in order to understand the brain changes that happen with addiction, we have to first take a quick look at the brain, and I think we have a picture of that.
We do.
Okay,
you
great.
Shared with us
Great.
how addiction takes hold of the brain.
So if you look at the brain, very deep inside the brain, there's a system called the limbic system, and this part of the brain is extraordinarily powerful over our motivations and our drives. And this part of the brain, although it's so powerful, we have no rational control over the limbic system. Our rational brain is in the frontal area over here. Now, they look close, but they might as well be two separate brains. In fact, when the brain is forming...
Not close enough.
Yeah. When the brain is forming in the uterus, that limbic system is formed first. It's a separate brain. That rational brain comes later. Because the reason for that is the limbic system controls our critical drives for survival and procreation, like the drive for food, and also our entire automatic or autonomic nervous system, which controls...
So this is more of the primitive drive.
Absolutely.
The more animalistic.
Absolutely.
Okay.
Absolutely. So it runs our entire bodies. We have something like 35 trillion cells in our bodies and organ systems, and it runs and coordinates that at all times. There was no reason for nature to give us the wiring to control that, okay? Now, the reason I'm going into this is because what we know now from advanced imaging, like functional MRIs, is we can see that the neurological changes that are happening in someone who develops addiction are happening inside the limbic system and not the rational brain. And that's very critical because what happens is the rational brain pulls the strings on, the limbic system pulls the strings on the rational brain. And the rational brain doesn't have the wiring to go back and restrain it because we weren't given the ability. There was no purpose for us to control things like drives for hunger and our automatic nervous systems. So now, what ultimately happens is that the limbic system every day is saying, we have to have opiates, it's the number one priority, and the priorities of life start to shift. So no longer do we have normal drives of life, but opiates become the number one priority, and the limbic system wins the battle every day over the rational mind.
Which makes complete sense, which is why your approach is so revolutionary, because you address all of those issues.
You have to.
You address the limbic system, you say that the 12-step program is important along with all of these other interventions that you're making. Tell me about the detox process.
Sure. So there are really three distinct phases. What the research shows us is there are three phases to help people get better, have their brain healed, and stay that way. The first phase is detox. Now, detox, to someone who's addicted, is a very scary thought process because it actually is very brutal. There's a myriad of withdrawal symptoms that happens to someone who's goes into opiate addiction, opiate withdrawal, and the symptoms can be so severe that people can become suicidal even. And I mean, there are so many symptoms, but for example, you know, the brain believes that you're not giving it something critical, and so what happens is it sends out all these stress neurotransmitters, and your body goes into complete panic. You know, there's no sleeping for days on end, anxiety through the roof, nonstop sweating. So it becomes a near impossible. But that's no longer the case. Because we have these advanced neurological medications, suffering through withdrawal is something of the past. People no longer have to go through that suffering. We have fantastic medicines. One of them was recently approved by the FDA. You may have seen it on the news. It's called Lucemyra. And this drug helps with all of the withdrawal symptoms. Now, in my practice, we combine it with other medicines to completely shut off the withdrawal symptoms immediately so that detox is no longer something that someone needs to be afraid of. We can go right through it.
So this must help with helping people get to the other side of eliminating opioids from their cravings? Well,
actually, detox is just the first step.
Okay.
Because unless you heal the limbic system, actually, if detox was the answer, then we wouldn't have a problem.
Part of the answer.
Everyone would just go to detox
But
and
it
we'd be
must
fine.
be comforting to say to somebody who is addicted to opioids, you know, now you don't have to deal with the pain of withdrawal.
Exactly.
We have something for you. So that's one piece of the puzzle.
And it's a huge piece.
And that's a huge piece.
Because that's the number one reason people don't even reach out for help.
Just not even sleeping.
A study was done. Number one reason that people don't reach out for help, they're so afraid of withdrawal, they don't even want to talk to a doctor about it.
So let's get that message out there that there is a medication out there that can help eliminate some of the negative withdrawal symptoms and help people get through to the other side.
Yeah, and we can't even emphasize that enough, that we can shut off the withdrawal symptoms now.
That is so exciting.
Yeah.
Now, there's also something else given which has been around a long time, Vivitrol.
Yes.
Which is to also help with the cravings, correct?
Sure. So now once somebody goes through detox, now we get to the real healing. Okay? So the healing is we want to heal the limbic system. So how do we do that? We use Vivitrol. Vivitrol is a once-a-month injection. It's not forever. It's for 6 months to a year. Okay? It does 3 key things. 1, it stops cravings or thoughts for the drug. 2, it helps the limbic system heal and go back to a place where it was before it ever saw opiates. And finally, if somebody who had Vivitrol in their system did take any opiates, it would just bounce off the brain and sort of wash out of the body without causing anyone to get high or sick. This is not another opiate medication like a Suboxone or methadone, which is used. This is a healing medicine. There is no dependency, and when someone is done being treated, they're done.
Does it work for shopping?
Okay, well, it's funny you say that. It's being looked at for so many different things.
Well, let's
Yeah.
hope. Let's get to the Titron scanner, because this is also something that you mentioned happens in your office.
Yes.
And this measures also the limbic system.
Sure.
And what does this do in terms of
Sure.
for the opioid
Sure.
addict?
So this is a little detailed, but essentially what we learned is that now once you get Vivitrol treatment and your brain has healed, okay, now we want to maintain that lifelong, right? So how do we do that? One way is through counseling. Counseling is critical. Sober support network, learning coping skills to deal with stress, avoiding triggers. Medicine can't do that for you, and you need to have counseling ongoing because of the susceptibility that an individual may have to addiction. But born of the new science we have is yet another treatment. And what that is see, we are fortunate enough to be able to assess that limbic system because the limbic system runs a lot of autonomic processes in our body. So there's a couple different ways to check it. We use a Titron scanner, and we're able to assess how somebody's limbic system is doing. Does it look like the brain is functioning in an adaptive pattern and a healthy pattern, or is it a maladaptive pattern, okay? And that becomes very important because, and I think we have a picture actually of what the next step would be. If we see a maladaptive...
Yes, we have the scan.
Yes.
Yes.
So if we see a maladaptive pattern on the scan, then what we do is something called a cone beam CAT scan. Now these are ultra high resolution 3D images. This takes 42 seconds with the latest machines to get this. And the reason that we do that is because, now I believe we have an image of actually the second image where the brainstem is extending down into the spinal cord. Okay, so what we've learned, okay, is that the limbic system that we're healing deep in the brain actually extends down to the first part of the upper cervical spine. And that bone that's in front of that limbic system, there's one bone that protects it. It's called the Atlas bone. And it's called Atlas because of the Greek mythological god that carried the weight of the world on his shoulders, because that bone carries our head. Now, that bone protects the limbic system. So what happens is, if we scan you and we see that your limbic system is not functioning properly, connecting with the body, then what we can do is we can use this image to help go forward, please, to the CAT scan image. Next, we can use this image to see exactly where the Atlas bone is sitting, okay? And then we can use a treatment. You can go to the next picture, please. Called the Activator.
This is the Activator 5.
Now, the Activator 5 is a device that, using the 3D CAT scan imaging, we can place it right over the Atlas, right that bone that's over the limbic system, and it sends a painless, what feels like a vibration. And what it's doing is it's simply helping to balance out that limbic system again, to help that limbic system work and connect with the nervous system of the body in a healthy manner. So in summary, you go through detox, then we heal the brain with Vivitrol, and then to maintain that, we use counseling and periodic checking of the limbic system.
And so what kind of studies do we know about this kind of approach to the limbic system in terms of success rates?
Sure. So there's a myriad. Because of the opioid epidemic, it has forced all of us in this profession to really dig in deep and find out everything we can about the neurology of this. We have so many people dying, okay? Even the most well-intentioned, motivated people can't get out of the grips of this addiction. This is where all this information comes from. This is very new information. And essentially, we have studies showing so far that actually there's a study published in the prestigious journal of Nature recently, which showed that patients in the rehab who underwent this type of treatment actually had a 100% completion rate in the rehab versus under 50% for the other members. Less anxiety, better mood, less cravings, you name it, on and on and on.
This sounds definitely more comprehensive. As we're getting to the end of the show, I just want people to know where they can find you. Where do you currently practice?
Okay, so I'm the medical director of Bridge Back to Life, and Bridge Back to Life has several outpatient addiction treatment centers across New York. I'm also in private practice in Great Neck.
We're going to have a link so you can find Dr. Surasky, and we're going to have just contact information, and if you want to find out where other physicians offer these advanced treatments, we'll also put a link up for that information as well. So we want everyone to know, as a result of this show, that If you or someone you love is struggling with this addiction, there is new hope that is very exciting and has just proven very successful. Very excited to have you.
Thank you.
Such amazing work. And before we close for the show, I just want to let everybody know, on May 11th, I will be doing a conference, a renewal conference called Your Best Life Is Now. Come see me. We'll have special discounts for tickets. Lisa Oz, Dr. Oz's wife, will also be there. And we look forward to seeing you there. Thanks for joining us.
Thank you.